Good morning, good afternoon, dear colleagues. I declare open today's meeting. My name is Rolando Castro, and I am the Deputy Minister of Energy and Environment of Costa Rica. The President invited me to preside over the Assembly's deliberation for the Ministerial Meeting. It is an honor for me to be here with all of you today, as we have discussions on Agenda Item 9, Ministerial Plenary Meeting, driving the agenda for energizing healthcare. I would like to warmly welcome all delegations present. I would also like to extend a welcome to the Director General of IRENA, Mr. Francesco La Camera, the Director General of the World Health Organization, Dr. Tedros Adhanom, and our keynote speakers, Mr. Liu Zhenmin, Undersecretary General at the United Nations Department of Economic and Social Affairs, Dr. Rajiv J. Shah, President of the Rockefeller Foundation, and Mr. Alex De Jong, QRS, Director, Health System and Immunization Strengthening, Gaby. I would like to welcome our moderator, Dr. Convened Junquela, Member of Parliament of Sierra Leone, and the distinguished members of our panel. The Assembly has before it a background note with the same title contained in document A/11/BN/5. To focus our discussions, we will hear opening remarks by the Director General at this important issue, as well as remarks from our keynote speakers. This will be then followed by a panel discussions moderated by His Excellency Dr. Convened Junquela, followed by interventions from the floor. I now invite the Director General for the introductory remarks. Director General, you have the floor, sir.
It's my pleasure to welcome you to the ministerial discussion of the agenda for energizing healthcare. This session carries special significance at this time when health is at the forefront of the policymaker agenda. We are delighted to have with us today many distinguished guests and close partners from the health and the energy communities. I would particularly like to thank Dr. Tedros Adhanom Ghebreyesus for kicking off our discussion, as well as Mr. Liu Zhenmin, Mr. Rajiv Shah, and Mr. Alex De Jong for delivering the keynote speeches. Excuse me more for the pronunciation of the name was not the right one, so excuse me for this. And of course, my friend, Mr. Convened Junquela, thank you for moderating today's meeting. The spread of COVID-19 has brought the crucial issue of electrifying healthcare center to the fore. Hundreds of millions around the world still rely on healthcare facilities, either without or with unreliable electricity, mainly residing in poor, marginalized communities from low and middle-income countries. Decentralized renewable energy presents affordable, reliable, and rapidly deployed solutions that can have a transformative impact on people's lives. Even before the pandemic, promoting dialogue on the nexus of renewable energy and health has been an arena's priority. In November 2018, through the International Conference on Renewable Energy Solutions for Healthcare Facilities, ARENA brought together key energy and health sector stakeholders, and has since been supporting several similar platforms to raise awareness and provide thought leadership of on this issue. In 2019, we joined forces with WHO as the founding partners of the Global Health and Energy Platform of Action. And last year, we teamed up with the African Union Commission to advance renewable energy development to bolster Africa's response to COVID-19. At the country level, we are working with Burkina Faso to carry out the assessment of the overall energy needs of the rural health center and identify energy gaps to recommend robust delivery models based on renewables. One of the outcomes is the blueprint of renewable system design for health clinics, which will be enable application of the solution to a larger rural healthcare network within the country. The recommended solution will also consider specific energy requirements related to the ongoing pandemic. I'm glad to have here with us Minister Ouedraogo of Burkina Faso, who has been instrumental in taking this work forward, which we plan to expand to other countries as well. The electrification of all health centers worldwide require long-term planning and careful cooperation among all stakeholders, from the energy and the health sector. We need commitment, cooperation, and continued dialogue to ensure we address this urgent issue in the most appropriate way. I am confident that through a multilateral approach, our response can draw on the capabilities and resources of countries and institutions around the world and ensure that no region, country, or community is left behind. I'm looking forward to hearing your thoughts and, more importantly, possible solutions, as well as our arena can support the efforts in this important agenda. With your permission, Mr. Vice President, and before I hand back the floor to you, I'd like to show a short video. Thank you very much.
COVID-19 pandemic has exposed the weaknesses of our energy systems. Lack of access to electricity puts patients' lives at risk. Decentralized renewable energy can improve healthcare services in rural areas. Now, we have an opportunity to accelerate the electrification of healthcare facilities. Scaling up off-grid renewables for healthcare facilities requires our collaboration. We must combine the resources of the energy and health communities in the face of these questions. What role can policymakers and development partners play? How do we strengthen cooperation between health and energy communities? How can we enhance private sector's involvement? Together, we can address these questions and drive the agenda to energize healthcare.
Back to you, Mr. Vice President.
Thank you, Director General, for your remarks and for this interesting video. I now invite Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, for his introductory remarks. Director General, you have the floor.
Muchas gracias, Vice President. Excellencies, distinguished guests, dear colleagues, buenos dias. Good morning, good afternoon, and good evening. And I would like to thank Mr. Francesco La Camera, Director General of the International Renewable Energy Agency, for his kind invitation to share a few thoughts with you today. IRENA is a key partner for the World Health Organization, and we're very grateful to the agency for its support in our efforts to promote clean and sustainable energy and to accelerate access to energy for health facilities. And I would like to thank the Director General, Francesco. The COVID-19 pandemic has highlighted the importance of health and health facilities. Last May, WHO published a manifesto for a healthy and green recovery from COVID-19 with 6 policy prescriptions and more than 80 specific actions. The manifesto highlights the importance of ensuring a quick and healthy energy transition based on renewable energy, as well as the need to accelerate investments in clean energy for health facilities. It is unacceptable that today about 1 billion people worldwide are still served by health facilities with no access to electricity, particularly in remote settings and rural areas. In sub-Saharan Africa, for example, it's estimated that 1 in 4 health facilities has no access to electricity. Even when electricity is available, the supply is often unreliable. This can mean the difference between life and death. Electricity is required for the operation of medical devices, lighting, clean water, communications, and other critical services. Surgery, safe care, storage of medicines, and so many other essential services need a steady supply of electricity. Now, with the COVID-19 pandemic, we need power for cold chain for vaccines, to operate oxygen concentrators and ventilators, and to supply clean water. Access to reliable energy for all health facilities globally will be essential for achieving universal health coverage. This is why the electrification of health facilities must be a development priority. Renewable energy presents a key opportunity to provide clean, reliable, and cost-effective electricity to health centers, including in remote locations. We have already seen substantial improvements in some countries, but we must do more and faster. This is our shared responsibility. Let me give you 5 key priorities. First, we need to dramatically increase investments on the ground. Second, we need to advocate for political commitment and resource mobilization. Third, we need to support countries in implementing healthy energy solutions so that healthcare can be delivered to poor and marginalized communities. Fourth, we need to create enabling policies. And fifth, we need to increase cooperation between the energy and health sectors, nationally and globally. To address these challenges, WHO and IRENA are working with the UN Development Programme UNDP, the World Bank, the UN Department of Social and Economic Affairs, and many other partners in the Health and Energy Platform of Action, known as HEPA. HEPA aims to accelerate electrification of health facilities through renewable energy, as well as clean cooking, by bringing together key actors from the health and energy communities. Many of you have already joined HEPA, and I hope many more partners can join us soon. In the framework of HEPA, and in order to specifically address the need for increased political commitment and resource mobilization, I have recently convened the high-level coalition on health and energy. I'm honored that the IRENA Director General and many other leaders and champions have already agreed to join the coalition. I would like to commend IRENA for today's high-level session on identifying pathways to improve the health and well-being of the world's poorest through access to clean and sustainable energy. WHO stands ready to work with you, with all of you, to build a healthier fairer, more sustainable future. Thank you, and I wish you a very productive meeting. I'm in the middle of my board meeting, so with your permission, I will be going back to the board meeting. I would have loved to be with you, but I know you can understand. Again, muchas gracias.
Muchas gracias for your remarks and for taking time from your busy agenda to be with us in this important meeting. We really appreciate your presence here. And now I invite Dr. Rajiv J. Shah to deliver his keynote address. Dr. Shah, you have the floor, sir.
Thank you. Thank you very much, Vice President Castro. Good morning, good afternoon, and good evening, everyone. I'm grateful to Director General La Cámara and the team at ARENA for the invitation to speak. And I'm proud as ever to follow my good friend, Dr. Tedros, whose leadership through this global pandemic has been absolutely necessary and impressive. Nearly 1 year ago, Dr. Tedros and I were discussing the threat of COVID-19. And now 1 year later, we know that this disease has killed not only millions, but has dramatically reduced the ability of so many nations and communities to get back on the path of growth, of human development, of access to healthcare, and of the great convergence that allows nations and communities that live at a lower standard of resources and living to accelerate their growth and ultimately achieve a high level of living standards and national wealth. Indeed, much of the underlying thesis of global development and economics, much of what ARENA, the WHO, the Rockefeller Foundation, the World Bank, and everyone gathered here today seeks to do is based on that very idea that, in fact, nations that have a lower level of resources can simply grow faster and grow in a more inclusive way as they raise their own and their people's standard of living. What we see with COVID-19 is that this pandemic is turning that equation around. We now look out over the next 3 to 5 years and see that poverty is likely to increase, not decrease. We see that vaccine access in wealthier industrial economies is likely to come faster and more comprehensively than it is to much of the rest of the world. And these realities mean emerging economies will be threatened for both the public health crisis and the economic consequences of it for much longer than in other parts of the world. The Rockefeller Foundation is committed, absolutely dedicated, to arresting and reversing this great divergence. To meet this moment, we have committed $1 billion, not just to end the pandemic for everyone by expanding access to vaccines and other solutions, but also to address inclusive growth in the context of the recovery. And we believe that starts with making sure everyone has access to productive electricity, ideally from renewable sources. That's because when we look at what it takes to grow, what it takes to be part of a global economy, we know that energy and electricity is the absolute core requirement, and the lack of it is the core constraint to growth and inclusion. Before the pandemic, more than 800 million people were still effectively living in the dark. And since the pandemic start, more than 100 million additional people have lost access for this critical issue. So our best bet is that we can all gather as a global community and expand access to clean, renewable electricity for health centers, for communities, and for emerging economies around the planet. That is why the Rockefeller Foundation has expanded our commitment to this specific issue in an effort to make new advances in distributed renewable energy available to every home, every community, every business, and every health center that desperately needs it right now. This is the right moment, and this is the right technology. And with the right partners and investments, as Dr. Tedros just noted, we can finally end energy poverty within a decade, and we can finally ensure that every health clinic has complete access to electrification to support what is going to be a long-term public health response to this crisis and to other communicable diseases. As you return from your work after this week's assembly, I want to ask for your help with 3 steps necessary to take advantage of this opportunity. First, each nation needs to ensure that its energy regulatory framework welcomes private investment, supports renewable and distributed energy infrastructure, and is open and accessible and transparent. We are willing to work with any nation to create, to provide the technical support alongside other partners to achieve that objective, but that can only be achieved with true leadership from nations themselves. Second, every economy in the world that's achieved universal electrification has done so with real public investment. Emerging economies and their development partners should actively support with financial subsidies the inclusion of the energy poor, specifically the health centers that are the focus of today's discussion, and make sure that those subsidies also then attract much larger flows of private investment. Again, the Rockefeller Foundation is willing to work with any nation that seeks to utilize this approach with urgency during this crisis. Third, we must work together to align our investments, public and private, to make sure that projects can be implemented quickly, financed effectively, and in fact reach those whom they need to serve. The foundation has already created vehicles and programs to do so, and I've had the chance to visit some of them. Just one example I think is instructive. In India, and specifically in Bihar, I had a chance to see one of our solar mini grids that is supporting rural communities there. We now reach almost 500,000 people with these mini grids, and we find that our customers are able to repay the providers of electricity at more than a 97% repayment rate. We find that they are able to use power and electricity to start new ventures, to move their families upward, to support the health that their families desperately need. And most importantly, we find that private companies, in this case, Tata Power, are willing to partner with us, the Rockefeller Foundation, to expand this type of access to electricity to tens of millions of people in that nation alone. We believe that example can be instructive and can offer a roadmap for how in the future to ensure that every health center, every community, no matter how difficult to reach, is served with electricity to solve the crisis of COVID-19 and to lay the groundwork for inclusive development and growth in the 21st century world. Thank you.
Thank you very much, Dr. Shaw, and for your remarks. And we have taken note of your recommendations, and I bet most of the participants have. We appreciate also you being here with us today. And now invite Mr. Liu Zhengming to deliver his keynote address. Mr. Zhengming, you have the floor, sir.
Mr. Vice President, Dr. Tedros, Director General of WHO, my friend Francesco from IRENA, distinguished participants, ladies and gentlemen. I wish to thank IRENA for the opportunity to address this ministerial meeting on energizing healthcare. Energy is a key to the implementation of the 2030 Agenda for Sustainable Development and the Paris Agreement on Climate Change. Universal access to clean, affordable, and modern energy services is indispensable to eradicate poverty, empowering women, achieve many other SDGs, and leave no one behind. At the same time, to achieve net zero emissions by 2050, we need to rapidly accelerate energy transitions, even as we expand energy access. As the world struggles with the challenges of the COVID-19 pandemic, the interlinkages between energy and healthcare have become clear. Energy services are essential for responding to the pandemic. These include powering healthcare facilities, keeping the required temperature for medicines and vaccines, and supplying clean water for hand washing. Distributing solar power and energy efficient medical devices hold great potential for creating stronger and more resilient health systems, especially in rural areas. But while we have made significant progress in recent years, close to 800 million people still lack access to electricity. At the same time, let us not forget the disastrous impact of the household air pollution on millions of people around the world. Every year, around 4 million people die due to the smoke caused by burning wood and charcoal for cooking and heating. Women and children are disproportionately affected. We cannot achieve the Sustainable Development Goals on health and gender if 2.8 billion people still lack access to clean cooking solutions. Indeed, we must dramatically scale up action to achieve SDG 7 to ensure universal energy access and clean energy transitions. This is why the UN General Assembly has mandated the Secretary General to convene a high-level dialogue on energy this year. It will be the first global meeting on energy under the auspices of the UN General Assembly in the past 40 years. The event will take place in the forthcoming September during the high-level week of the 76th session of the General Assembly. The high-level dialogue on energy will focus on 5 themes. Number 1, energy access. Number 2, energy transition. Number 3, energy action to advance other SDGs, including SDG 3 on health. And number 4, capacity building and data. And number 5, financing and investment. As the Dialogue Secretary General, I call upon all stakeholders to engage in the dialogue preparatory process. We already started. It is imperative to bring practical solutions for a sustainable energy future for everyone. We will need to pool our collective strengths to achieve a future in which everyone has access to energized healthcare and clean household air. The Health and Energy Platform of Action has been created within the UN system and is co-convened by UN DESA, my department, UNDP, WHO, and the World Bank. We thus have at our disposal a global mechanism for cooperation by all stakeholders on these crucial interlinkages. Dear colleagues, a revitalized UN energy will strengthen coordination within the UN system and collaboration with IRENA and other strategic partners. IRENA's leadership and analytical capacity will continue to be critical to catalyze action towards the achievement of SDG 7. Let us now together set the stage for action. I wish this event a great success. I thank you.
Thank you, Mr. Zhengming, for your remarks and all the support from the UN and DESA on this endeavor. And now invite Mr. Alex de Jong Cuyeres To deliver his keynote address, Mr. De Jong Quires, you have the floor, sir.
Thank you very much, Vice President Castro. Good afternoon, good evening, good morning, Your Excellencies, ladies and gentlemen. It's an honor to be here with you and have the chance to address you all. I'm the Director of Health Systems for an organization called Gavi. Some of you may have seen Gavi in the news recently as one of the organizations that is helping to set up and is helping to run the COVAX facility. But our core mission is to bring the life-saving power of vaccines to children in the world's poorest countries. Since 2000, we've helped countries to immunize over 800 million children, and 80% of children in those countries now receive a Gavi-supported vaccine every year. That's helped to prevent 14 million deaths since the year 2000. That's over a death every minute, and helped to halve under 5 mortality. That is the power of vaccines and immunization, and of course we're being reminded of that now in the context of the COVID outbreak. Gavi is a global health organization, but we're also a major investor in renewable energy. Why is that? Well, vaccines don't deliver themselves. As several speakers have already remarked, they need a robust supply chain that reaches into every single community that we seek to serve. And that supply chain has to be able to keep vaccines cold at every step of the way. Since many health facilities don't have access to electricity, as many have noted, in the world's poorest countries, we need to look for other solutions. Historically, countries relied on fridges that were powered by gas or by kerosene. Those fridges were expensive, they were unreliable, they didn't keep vaccines at a steady temperature. They also required a steady and expensive supply of gas or kerosene, and of course they were highly polluting. So in 2015, Gavi launched what we call the Cold Chain Equipment Optimization Platform, the CCEOP. And the idea was to accelerate the deployment of new cold chain technologies to countries we support. Since we worked with countries to install the first fridge in mid-2017, we've spent nearly $200 million on procuring new cold chain equipment and installing over 50,000 fridges, of which over 30,000 were solar, with their own solar panels. But this has allowed us to enable delivery of immunization services in a much greater range of locations, to ensure that vaccines remain potent throughout the supply chain and minimize wastage, and to also reduce the climate impact of immunization programs. What have we learned from the CCOP that might be relevant more broadly? I wanted to highlight 3 particular things. The first is that technology enables us to do things today that we couldn't have conceived of 10 years ago. As an example of that, when the first solar fridges were installed, they worked relatively well for a while, but then they started breaking down. And the reason they broke down is because every fridge required a battery to power it when the sun wasn't shining at night or when there were storms. And those batteries didn't last very long. And when the batteries died, in many cases, they weren't replaced and the fridge stopped working. Today, we use a technology called solar direct drive. It replaces an actual battery with an ice battery. The spare power from the panel is used to create an ice lining around the fridge when the sun is shining. And that can keep the vaccines inside cold at the right temperature for hours and sometimes even days at a time when the sun is not shining. That solar direct drive technology is now deployed from the most remote communities in DRC to conflict-affected areas of South Sudan and many other locations where there's very little else, sometimes not even a full facility, where the fridges can operate reliably day after day, week after week, year after year. The second lesson is that with the right partnerships, it is possible for us to solarize at scale, rapidly, systematically, and at a very high quality. On average now, we are installing solar electricity in over 25 sites every day of the year. How do we do that? Well, the first thing I think that we learned is that the investment you need to make up front is significant. Many of the countries we work with weren't able to tell us where they needed solar power or what kind of solar power they needed because they didn't know what size of fridge was needed where throughout the countries that we were working with. So the first thing we did was work with countries to map an inventory of health facilities and their specific needs. It took time, and we didn't move as fast as we would like, but that means that today, most of the countries we work with know what their needs are at each facility, know what equipment they have there. And when COVID struck, and with the preparation for the introduction of the COVID vaccine, these countries were able very quickly to assess what are the gaps in their cold chain and what do they need to expand to be able to accommodate that vaccine. The second thing was strong government-driven project management. We put a real emphasis on very, very robust operational deployment planning, working closely with countries and with our partners, and with dedicated project management structures. And the third was effective partnership with the private sector. The fridges that we buy, we don't just buy the fridge, we buy a fridge which is installed at the sites where we want it installed, with training provided to health workers. And that accountability sits with the manufacturer of the fridge. They are responsible up to the point that the fridge, the solar panel have been installed to high quality, and health workers have been trained on how to maintain them. That has proven a very effective model for ensuring that once the fridge is procured, it moves very quickly through the supply chain and is deployed as quickly as possible thereafter. The last lesson we've learned is that through partnership, we can achieve even more than we can alone. I'll give two examples of this. Firstly, within immunization, we're historically quite a siloed community, and the cold chain was a good example of that. Historically, we had an immunization cold chain, and nothing else was kept in that cold chain. We're now working with WHO to ensure that going forward, countries have one cold chain, that they are able to manage all commodities through a cold chain, and that all commodities and all health programs benefit from the solarization and the deployment of cold chain equipment that we are supporting. But we want to move from that one cold chain agenda to a broader one electrification agenda. We're already moving in that direction by ensuring that when we install a fridge, that we design those fridges in a way that enables health workers to harvest spare energy from the fridge for things like charging a mobile phone, for lighting, for cooling, and even to run basic diagnostic and other medical devices. But in the long run, our vision is to ensure that when we invest in installing solar energy in a facility to power a fridge, we're doing it with other partners too, so that we are jointly providing full electrification for a health facility and not just powering cold chain at the end of it. And we believe that the work we've done and the model we have is something we can build on in order to do that. And we're delighted to be working with WHO, the World Bank, and others to explore how that might work. Thank you very much for having me, and I look forward to the discussions over the rest of this session.
Thank you, Mr. De Jong Quieres, for your remarks, and to all the distinguished members of this session for your important discussions. It is now time for us to hand over to Dr. Kande Junkela to moderate the panel discussions with our distinguished panelists. After the panel discussions, we will open the floor for interventions. Since I have to attend other matters of my agenda, I will hand over the chair to His Excellency Francisco Chacon, which is the permanent representative of Costa Rica to IRENA. And I really thank this opportunity to chair this session and also other sessions during this assembly. Thank you very much and have a good rest of the discussions. Dr. Junkela, you have the floor.
Thank you very much, Vice President, for this opportunity. Distinguished ministers, honorable members, ladies and gentlemen, we have listened to the call to action of several great leaders. I have had the privilege of working with a number of them, and I really feel honored to see that today, under the leadership of Director General of IRENA, other Directors General from the UN system and also from the Rockefeller Foundation have been brought together to address one issue. Each of them, I know over the last 3 years, having worked with them separately in different capacities, they've all been addressing these issues. And what they demonstrate as a good beginning of 2021 is how we bring these knowledge systems and resources together to address a common problem, bringing the energy community and the health community together. I want to congratulate all of them and their staff for the work they've done over the past few years. I represent a very poor constituency in one of the poorest countries, which is Sierra Leone. Some of what has been described by our leaders, I see on a daily or monthly basis. Yeah, there's not a single month where we don't have an incident of a woman delivering a baby in one of our PHUs in my constituency where there's no electricity. Every month, there's not a single month where we don't have a case of maternal mortality, a woman dying because she was delivering a baby in the dark or because of hemorrhaging and there's no blood to provide. I have seen many of these cases around the world, but now I am representing a location where this is real. So what the discussions we've heard so far, the opportunities that exist to solve it. The director of WHO mentioned 1 billion people serviced by health facilities that still do not have electricity. This can be made history. We can solve this problem today with the technologies that are available, with some of the examples Gavi and others have given, that in fact we can do this, we can do it at scale. We have the renewable energy technologies and other associated equipment and technologies to solve these problems. Well, we've heard the commitment of our leaders to move this agenda forward, their willingness to cooperate on the ground and globally to bring attention to this issue, to mobilize resources. On the panel now, we turn to practitioners from various countries, policymakers, who are trying to deal with this practically on the ground. And we've assembled a very impressive panel for you today. The CVs have been circulated, and now I'll go according to the list that have been provided. Each panelist has about 5 minutes to make their intervention, and then later on the Vice President will open it to member states to make their own comments. We start with His Excellency, the Minister from Ghana. He's been called off because of an emergency, but he's asked Mr. Wisdom Tukobo to deliver his message to the plenary. Over to you, Mr. Wisdom Tukobo.
Thank you very much. It's unfortunate my honorable minister is indisposed and he has asked me to deliver his statement in regards to this panel discussion and where necessary, stand in during the discussion. Indeed, Ghana's electrification rate currently stands at 85%, and we are committed to achieving universal access ahead of the sustainable energy for all target by the year 2030. We want to ensure that every community with population above 500 inhabitants in the country has access to electricity. Electricity currently has been extended to all 265 districts in the country, and it is the policy of government to have at least one factory in each district, and it's code-named One District, One Factory. Let me at this time thank the President, Spain, for nominating Ghana as the Vice Chair of the Assembly, and we look forward to a very fruitful working relationship on this arena assembly. I also want to state that at this point that Ghana achieved universal access of 85%, and this has been based mainly on grid extension. This is simply because Ghana has set itself an objective We want to use electricity to stimulate economic and industrial development in rural areas, improve social livelihood of rural Ghana, reduce rural-urban migration. And Mr. Chairman, let me also say that this notwithstanding, renewable energy solution also have a very important role to play in ensuring the achievement of our target for universal access. Mr. Chairman, for communities where it is difficult to extend the national grid due to their geographic location, the target is to deploy decentralized renewable energy-based electricity and off-grid renewable solutions. To this end, the government of Ghana has deployed mini-grid and off-grid solar electrification in most of the hard-to-reach areas in the country. The focus, however, has been the health facilities without electricity, where even basic vaccines to fight diseases such as malaria, snake bites, and other illnesses could not be stored. The situation has been compounded with the current COVID-19 pandemic. Here, we see solar electrification to become very handy and cost-effective. And it is for this reason that the Ministry of Energy is liaising strongly with the Ministry of Health to ensure that all health facilities in non-electrified communities in the country are provided with solar power until such a time that grid electricity is extended to these communities. Let me use this opportunity to express our gratitude to most of the development partners, and especially the UN Foundation that have supported Ghana in this drive. Deployment of renewable-based electricity in these facilities is key to ensure storage of vaccines for reducing mortality rates. Solar electricity in these facilities also help to facilitate information dissemination on healthcare and adherence to COVID-19 protocols. Furthermore, where there is solar electricity, health professionals are willing to accept postings to these remote communities. And it is interestingly, solar electrification does not only bring benefits to health facilities in rural off-grid communities. You will agree with me that most communities in sub-Saharan Africa experience power outages one way or the other. Can you imagine being on the operating theater only for the power to go off? But with access to solar backup power, some deaths could easily be avoided and vaccines could be properly stored. The challenge, however, with solar-based electricity, as was said in the introductory statement, has to do with the high cost and short lifespan of batteries, which unfortunately happens to be the heartbeat of any solar system. Most often than not, no adequate budgetary allocation is made by the health facilities for battery replacement. And this results in system being abandoned until government or a donor partner comes to their aid to replace the batteries. The good news, however, is that battery technology is fast evolving. And today, one can find lithium batteries that could last for more than 10 years. We just hope that the price of these batteries become cheaper and affordable. And not only that, but it should be locally produced to ensure that we can continue to deploy solar electrification in the remote communities. Thank you very much for the submission.
Thank you very much, Mr. Tokobo, for your excellent presentation. At the end, you mentioned two key problems that I hope later on some of our distinguished panelists can address. The issue of replacement of batteries, but let's combine that later on with the issue of maintenance of systems once they're installed over time, but also this important issue of local production of components, where I know a number of developing countries have an ambition to be part of that value chain of producing components required for energy systems. We now turn to His Excellency, the Minister of Burkina Faso, Minister Ouedraogo. I want to thank you very much. I have been with you now on several panels over the past few months, whether it's the International Energy Agency and other panels, where you're making the strong case for renewables in Africa. But I also know you've had this wonderful partnership with IRENA now, and bringing your colleague, Minister of Health, also together with you. Over to you, sir. How do you see the situation in Burkina Faso, and how do you begin to anticipate distribution of vaccines and having renewable energy available for that? Over to you, sir.
Thank you very much, His Excellency. And I would like to thank everybody and the Director General of IRENA, our good friend, Dr. La Camera, and to you all. It's my honor to have the opportunity to talk about this important issue. Burkina Faso is currently working with IRENA to carry out assessment of our healthcare system. And the objective is that by the end of the project, we'll be able to provide electricity for 1,200 healthcare facilities. As we all know, without electricity, it's very difficult to have a good healthcare system. Electricity impacts the whole system: healthcare, education, economy, technology. So our objective is now, how can we do to make sure that we'll be able to tackle this important issue, which is providing electricity for all. In Burkina Faso, we don't have too much natural resources, but we are blessed to have the sunshine like so many countries. And it happened to be the best thing that could happen to us, because we rely on solar energy. And let me tell you that within 5 years, we passed from 3% of the population in rural area that have access to electricity to 25%, 30% of the population that have access to electricity in rural area. And within these 5 years, we have been able to make sure that 550 healthcare facilities have access to electricity. So having done that with the help of solar, I think that this is an opportunity for all of us to be able to tackle a very important issue, which is how are we going to provide electricity for healthcare facilities? We all know that the lack of electricity in healthcare facilities are impacting women's lives, the possibility to store vaccines, the possibility to make surgery, and it's bringing down the quality of lives in rural area. So today, I would give you a couple of examples. We are able to reduce the cost of the kilowatt hour of electricity in my country by 4 when we compare solar energy compared to fossil fuel and other type of electricity. So today, it's a matter of finance. It's a matter of economy. Renewable energy is giving us a great opportunity to reduce electricity cost. We all know that the cost of electricity is impacting the access of electricity. The higher the cost of electricity, the less people have the possibility to access electricity. And we all know that in rural area, people don't have enough financial capacities. So we need to bring solutions that will be affordable for rural populations and help them to access electricity. So today, a renewable energy, and especially for my country, solar energy, is a key solution. And I think that with the leadership of IRENA today, and what we have seen during the COVID situation, we have seen that solar energy and renewable energy as a whole was a great opportunity for our economy to swing back So we now have to learn the lessons from what we have seen during the COVID pandemic. And I would say that today, with the falling cost of the technology, when we look at solar panels, when we look at batteries, the whole technology is just bringing the cost down. On the other hand, we have the financial world that is ready. The world has never had enough money to invest in electricity than now. So we have the possibility to give universal access for electricity to all. When we look at the cost of investing, the cost of putting solar energy in health facilities, compared to other type of costs, we know that today the world have the capacity and we now have the resources to make it happen. We are making a tandem with Selco in India. We are looking at examples with other developing countries, and we are taking examples and to bring it together with the way that we are doing here in our country to make sure that we move forward. So my advocate will be that policymakers, especially Minister of Energy, Minister of Healthcare, and other ministers, agriculture and other departments, need to give hands together. We have everything in our hand. We have the technology and we have the financial resources. So please, let's move forward. Let's go together and make sure that we will have a sustainable world for the current generation and the coming generation. We have the possibility to give a fair and sustainable world for all, and that's really my advocate today. The example of Burkina Faso can be shared with other countries. We have done it, and if we have been able to do it, other people also can be able to do it. So let's move together, let's give hand and make sure that we'll give a better world to all of us. Thank you so much for giving me the opportunity to share our view and the example of Burkina Faso with all of you. Thank you very much, His Excellency. Back to you.
Thank you, Honorable Minister. Thank you for the points you've made. We take note of the great opportunity in Burkina Faso. Renewables helps you reduce the cost of energy. The collaboration and learning from others you emphasize, for example, the work that is Selco Ecosystems work Selco is doing in India, but also in the end, which is very crucial, and that's the purpose of this particular forum. They need to work together, and you're working together with your Minister of Energy, but you also mentioned the need to work even closer also with the Minister of Agriculture, and that's the purpose today. How do we bring some of these silo approaches together so that we can solve some fundamental problems? We transition now to a Minister of Health. I have been in a country once where the Minister of Health explained energy better than even the Minister of Energy, because the Minister of Health could see the impact of lack of energy in her clinics when I visited her country. In this case, we're very pleased that from India, we have from the state of Chhattisgarh, Honorable Sri Sindeo. You have done excellent job in pushing solar solutions into your health systems in your state. In fact, recently you won the Ashton Award for some of what you've done. What are the lessons you've learned as you've been able to achieve so much success, and what are some of the remaining challenges you see as you go ahead? Over to you, Honorable Sri Sindeo. I don't think your mic is on. Honorable Sindeo.
Am I audible now?
Yeah, go ahead, Excellency. Yes.
Thank you. Respected Director General, respected Vice President, thank you, Mr. Kande, Maria, Mark, all the respected health ministers from various countries and states. I am extremely grateful, thankful, and honored that IRENA has given me this opportunity to interact with them, with other members of the world community. And I would especially like to thank Mrs. Gauri Singh, who was a member of the Indian Administrative Service. She joined you. Our loss has been your gain, I'm sure. And I thank her for giving me this opportunity to link up with you. Our health structure in the state of Chhattisgarh is 5-tiered. We have the sub-health centers for 2,000 to 5,000 population. This is the mother and child care, NCD, checking and data collection at the village level from 3,000 to 5,000 populations. Then we have the primary health centers for populations up to 50,000. Then we have the community health centers, which serve populations of about 1 lakh. And then we have the district hospitals and the medical colleges. This is our tier of health service public sector. And among the 6,111 units that we have, these health care units that we have achieved modest targets so far. Of the 28 districts, we have 24 districts connected with solar energy. Of the 174 community health centers, we have 162 connected with solar energy. Of the public primary health centers, 783, we have 703 so far connected with solar electricity. And we have a way to go in the smaller units, which are in the villages in our rural hinterland. And of 5,127, we have just about started. So far our modest contribution has been, I am told, 3,988.9 kilowatts of solar energy installed. It's a small beginning, and we are grateful that we have been recognized for this effort. And I would thank our state agency, CREDA we call it, the Chhattisgarh Renewable Energy Development Agency, for initiating this, installing the solar panels, which are functioning very well. As you all know, particularly in the rural areas, we have problems because the sub-health centers cater to primarily, or used to primarily cater to institutional deliveries, maternal care, child care initially. And if ladies were coming in at night during their delivery schedule, if there were no lights, there would not be nurses, and they would not be able to avail of the institutional facilities. So solar energizing these units has gone a long way in providing 24/7 services, not only ensuring that the staff stay on. No lights, the staff tend to lock up the facility and go and stay in a neighboring house or an adjoining house, and we are not able to deliver healthcare facilities when there is this emergency, particularly during the night time. Okay, the country is going forward to see that every house has electricity. So all these facilities would have the traditional electricity supplied through poles and wires. But we are looking to a much greener world, a much cleaner world, and solar energy is the option that we have adopted so far. The other renewable energy options are not quite as viable as solar panels have been. Wind energy or other options, they don't seem to be as viable. You may not have the wind speed, you may not have other conditions. So we are opting strongly for the solar energy option and installing them in all these facilities. For example, if 24 of our district hospitals have solar energy panels, they are not the rural hinterland, but they consume more. Okay, there is a saving in electricity bills, but the largest saving is in bringing about a cleaner, a healthier, greener environment. And I think that with ensuring 24/7 services, our Honorable Minister, His Excellency from Furkuna, I believe, was mentioning the energy that would be available 24/7 for keeping up the medicines and other services. So with that, I think we have, in our experience, seen that it certainly helps all round. If you are to keep medication, you have to keep medicines. We have temperatures up to 40-45 degrees centigrade. And if these medicines are not kept in secure temperature facilities, their chemical contents are likely to change. So that is where solar energy, 24/7 solar energy is of immense help. It's of immense help in ensuring that we continue to provide good quality medication around the year. The benefits from electrification, and solar electrification, clean energy are not new for me to say. And we are wanting to extend these facilities into the community as well. As time comes, we will not only be taking up solar energizing our units, our healthcare units, but also the community at large. So the solar panels will be installed, keeping that in mind. And it also provides us with internet connectivity, internet access throughout the 24/7 period. So there are various experiences that we have had, and we'll be building on the ground. The other things we are looking at doing is drinking water pumps installed. We have installed 84 drinking water pumps. We have solar high mast units also that we have installed. We have installed solar waste purification systems too, but these are beginnings. It's a long way to go. We have started on this greening path, and I hope we are able to achieve the goals, which obviously would be 100%. I hope we are able to reach these goals as soon as possible. What we are looking for the future is evaluating the solarization of the entire or as much of the public health facility as has been installed. I mentioned this 5-tier healthcare facility, which takes care of our primary, secondary, and the tertiary care levels. So all these 5 levels that would take care of the primary, secondary, and the tertiary health needs is what we are looking at. It's a long way to go, but this is what we are looking at for the future. Accordingly, we have tied up with CREDA, which is our state agency for the development of solar energy, to install these efficient plants throughout all the healthcare facilities, looking primarily at the geographical sites, giving them priorities. We are looking at using solar energy for our medical equipment too. We are looking at creating models that would be based on solar energy. The geographical vulnerability, like I mentioned, we are taking that as a priority, and various other needs of healthcare that we can achieve through solar energy is what we are keeping in mind. Utilization of solar energy, we have gladly seen it has impacted our, in fact, it has confirmed our commitment to go ahead at a faster pace, and in the time to come, we hope that we have all our facilities linked to solar, cleaner, greener energy sources in the next 2 years. Thank you so much.
Thank you so much, Honorable Minister. A lot of issues you raised from your experience there, but you also mentioned the challenges you still have to reach the 527 smaller PHUs, primary healthcare units in the deeper rural areas. Your good collaboration with CREDA, your Renewable Energy Agency, has also been very useful. But you also mentioned here, which is important in our discussion, this link of access to clean water and the role that renewable energy has played in your experience. But you mentioned that that's an area you want to expand. But you talked a lot about reliability. When you have 40 to 45 degrees, you can cool for 3 hours, but if power goes out, you'll be in trouble. And indeed, you've emphasized that solar solutions will be very useful to you. It is a pleasure for me to turn to a true medical doctor on the panel, a good collaborator, Dr. Maria Niera from WHO. I'm sure as you're listening to all of these, you may be reflecting 15 years ago when you were trying to teach myself, the UN Secretary General and others about this important link, energy and health, household air pollution, outdoor air pollution. 15 years later, as you look at this and look ahead, I'm sure you're happy today to see Director General of WHO, Director General of IRENA together, working together. Over to you, Dr. Maria Niera.
Dear Junke, what a pleasure to hear you. And it was 15 years ago. I was not expecting a gentleman like you giving numbers of how many years ago it was. But anyway, I accepted, and it's for the good cause, so thank you. And I'm really very pleased. Thank you very much, Director General, honorable ministers and colleagues, and Gabi collaboration is fantastic. It's really a pleasure. And as Kande was saying, yes, I used to be a real medical doctor. And that's why when the distinguished delegate from Ghana was talking about, he says, imagine you are on an operating room and you don't have electricity. I don't need to imagine that. I went through, and I can tell you that it's absolutely frustrating and really very, very bad. The fact that you are trying to help people on a healthcare facility, and if you don't have the basics for that will be water, sanitation, hygiene, and electricity to perform all of those activities that the previous speakers in a very eloquent way they were saying. My frustration, Kande, is that when I was a young doctor, I was facing that. And today, several years after that, I'm afraid it's still the situation in many healthcare facilities. So let's focus on the collaboration we have here today, on the awareness raise that we have been able to put together, on the commitment by many of the ministers from health and from the environment. The fact that our Director General, as you say, is very happy about this collaboration, this HEPA platform in which we put energy and health, recognizing that both are very, very much linked. The health argument is very strong. You hear it. We need energy to perform all of those activities. And in addition to that, we need as well renewable energy, because otherwise the air pollution will keep killing us. So we need to accelerate this transition to a healthy energy, and particularly important in the healthcare facility. So I think I'm convinced that this health argument is very strong, very powerful, and we can provide even more arguments if there are needed, because the evidence is huge, and we could obtain a maximum benefits for the health of the people if we accelerate on a very ambitious way this transition to renewable energy, and we provide it to the healthcare facilities as a priority. My second message, the first will be this strong health argument. Famous sentence that always goes with the SDGs. We always say, leaving no one behind. Well, we are leaving many people behind at the moment, and I would like to make sure that we leave something very strong behind. So that's why I was so happy when the collaboration with Gabi on making sure that we can upgrade the solar panels that they are providing now for refrigerators. They can be upgraded. This is a project with WHO and Gabi and with Irina. We are very happy that this can be at the moment where the world is facing, they have the most massive vaccine distribution exercise that we will ever had in the past. I hope that we will leave something behind, something very positive and impactful, that it will be those solar panels for the healthcare facilities. Instead of using it just for a refrigerator that will keep a vaccine, hopefully we will leave behind an incredible heritage on being able to provide electricity to the healthcare facilities. Thanks to this effort. Thank you very much, Alex, and of course, Francesco La Camera, for this collaboration, and others that I'm sure will join, because this can be an enormous contribution that we can leave behind after the COVID-19, which is challenging all of us. And my third message is that those are investments that are so common sense, so basic, so logic. I mean, the non-regrets investment. Who will disagree with the need to invest on water and sanitation and electricity if you want to obtain at the end health? And that's why, as mentioned by Dr. Tedros, on our manifesto for healthy and green recovery, we have stressed the importance of access to clean energy as a critical effort for if we want to protect people's health, and if we want to influence the investments that the governments are doing now on the recovery of COVID-19, and of course, investments on essential services like electrification of healthcare facilities and access to safe water and sanitation. So my last message to all of you is that you have all the arguments, you have the technology, there are new commitments, Rockefeller, you have
Test on the English channel. Test. The Russian booth. Right.
This is really a very important health issue. We are suffocating with air pollution, and we cannot accept those 7 million premature deaths. And that's why we need to accelerate moving to renewable energy. And in addition to that, our healthcare facilities cannot suffer anymore this dramatic situation on not having the minimum services for at least allowing people like the young doctors that are now there to provide the basic services and save people's life. So thank you, Cande, and I hope that in 15 years from now, we don't need to talk anymore about this, because any healthcare facility around the world will have fantastic sources of energy. Healthy energy to all colleagues and collaborators and excellencies. Ministers, good luck. Thank you.
Thank you so much, Dr. Nera. Thank you very much indeed. I am very confident that just like Ghana is trying to achieve universal access before 2030, I am confident with this collaboration we're beginning to see here that in fact we may achieve universal access to energy and health facilities before 2030. So before the 15 years, you and I will be celebrating.
I trust you.
When the president of Rockefeller Foundation was speaking, he talked a lot about combining public and private investments, creating that enabling environment. So as he said, to align public investment with private investment to leverage even greater impact. I mean, our next speaker, he and his organization, they have first-hand knowledge of this. We've seen what they've done in Africa in a very short period, how they've tried to bring this deep alignment and bring in additional resources to leverage private capital to come into the power sector in Africa. It is my pleasure to bring in the coordinator of Power Africa, Mr. Mark Karato. Over to you, sir.
Well, thank you very much for the kind introduction. And per the last comments, I hope to get invited to that party before 2030 when we hit this goal. Certainly looking forward to that. And of course, you referenced as well Dr. Shah, who of course has strong ties to USAID and is a great collaborator. But I just want to start by thanking everyone again. It's honorable ministers, colleagues. It's a huge honor to be part of this. But as I pivot to my remarks, I'm struck. It's also a huge responsibility. We've always known, but we see so much more now with such detail that access to electricity not only changes lives, it literally saves it, right? So through power of partnership, which is how Power Africa chooses to operate, we want to meet this urgent demand for clean and reliable energy, particularly for health clinics and particularly during the pandemic. Hopefully most of you know Power Africa is a US government-led partnership that brings the collective resources of more than 170 public and private partners to get two key development goals: 30,000 megawatts and 60 million home and business connections. And we're well on our way, but there's a lot of work to get done. As everyone's mentioned, and I'll go to this area a bit because I think there's nothing wrong with reinforcing just how important this work is. And the pandemic has put it in such focus, right? The need for electricity is certainly urgent, and at times it's tragically simple. As some of the great examples we've heard before, people are dying because they just don't have access to electricity, and we have to change that. Close to 60% of the health facilities in sub-Saharan Africa don't have access, and less than a third have reliable access. Crazy numbers on some levels for sure. Clinics obviously need to power refrigerators and medical equipment to store vaccines, operate life-saving equipment. According to WHO colleagues, 25% of liquid and 50% of freeze-dried vaccines are wasted each year. Unreliable power is the single most common cause of medical equipment failure in sub-Saharan Africa. And we know that these lack of basic services, not only in those very technical ways, but they have major health impacts. Still today, Africa is the only continent where preventable infectious disease will outnumber deaths from chronic. And a lot of this has to do with the fact that we have to make sure we have the energy to foster healthcare. COVID-19 obviously exacerbates this and makes it even more dire. So, it's imperative that we work toward those goals. We also need to work toward these goals, of course, because it's imperative to have electricity for the recovery efforts, not just the immediate healthcare efforts. Energy poverty has massive implications, as everyone knows, for human and economic development. But countries that are able to provide sufficient, reliable, and affordable energy will be able to rebound faster, and their GDPs will come up quicker by improving agriculture, gender equity, educational outcomes, for example. To do this, we're driving new investment into the energy sector. IRENA estimates that Africa requires an annual investment of $70 billion in renewable energy through 2030 to make this transformation take place. And missing this opportunity will lose 30 to 40 years of time in the requisite higher emissions. So we have to get this right. We have to do this to mitigate global climate change. We all know that. We look forward to doing this a number of ways. And thank you for the introduction with the partnership, because it's always my calling card as well. As I mentioned, absolutely pleasure to be here today in partnership with IRENA. We renewed our MOU just yesterday during the sessions and looking forward to that strong and continued partnership. We look forward to partnering with them on their Clean Energy Corridor initiative to ramp up regional trade within Eastern and Southern Africa. We're also working on scaling up regional trade through our Unlocking Solar Africa Solar program in partnerships with the governments of Botswana and Namibia. And of course, any other number of new innovative solutions as we move forward. We need these sources of investment to meet our goals for the Sustainable Development Goal that we're all here today to talk about. Let me pivot to Power Africa for a second, because we're proud that we're making a difference. Since we've launched in 2013, 18 million homes and businesses have got new off-grid solutions. That means first-time access for 88 million people, again, in partnership with all of you. We realize that renewable energy still provides less than 20% of global fuel, so we have a lot of work to do to improve that. For our 80% of transactions we've closed so far, more than 50% are based on renewable energy. So we particularly echo IRENA's call for decentralized renewable energy solutions as well, such as standalone solar and mini grid systems as one of the most cost-effective ways. A lot of those transactions we closed have been both on the grid, but also off grid, which we think is critically important. So we will continue that work, and we would have done that anyway. But because of COVID, like everyone else, we've redirected at this point nearly $6 million toward these efforts. I'm just going to give two examples. There's a lot, but I think they're important. In Kenya, for instance, working with the utilities, we've helped bring more deliverable energy services to 600 active health clinics and 2.2 million customers by working at this level of knowing that there's second and third order effects. We have to not just hit the clinics, we also have to hit the companies and utilities that support them. In Nigeria, we work with Rural Electrification Agency, private sector, World Bank, many others to do a number of things. We helped assess the power loads for the hospitals, the health centers, and the critical care facilities. We advocate for solar home systems to be deemed essential services during this time. We've used GIS mapping to prioritize the deployment of home solar systems to make sure it got to the best and most urgent needs. And we've also worked with the Nigerian Ministry of Finance in calculating the impact of COVID-19 on the electricity sector. So just a couple of examples to look at. Within that as well, though, we put almost $3 million directly toward the private sector solution. And in this, I mean, we looked at companies and innovative solutions to figure out how to not only electrify clinics themselves, but innovate around the financial models that will be needed to what you said. We need to crowd in that private capital. None of us can afford to just write a check to solve these problems. The private sector has to be driving the solutions and the capital pools. This will help strengthen the resilience of African health systems. This will help us, as I mentioned, pilot new sustainable ways to do this and new technologies. And it will demonstrate the role that private sector can have in all these solutions. So again, just two examples. US company Off-Grid Box is one we're working with. They're deploying containerized solutions for solar energy to provide energy for healthcare, powering lights, communication, appliances, et cetera. But they're not only doing this, they're actually also, and we're proud of this, creating jobs and improving lives. They hire and train female entrepreneurs as their box keepers, who then in turn now sell the power and the clean water of the communities. So absolutely critical there. Another example, PEG Africa will soon offer pay-as-you-go solar-powered refrigerators and freezers. Great mention of them in a CNN article we caught last week. But again, very technical and innovative solution that will be part of the overall solution, no doubt. So to end, like everyone else, I join in this collective call to action. We worked with Sustainable Energy for All, including IRENA and other partners last November to coordinate a plan of action for country-level healthcare electrification. We continue with those efforts. In December, we signed on with Rockefeller as well for the $1 billion initiative to bring sustainable and renewable energy to people around the world. Look forward to those efforts. And we will carry forward this momentum with the public and private sector as we go for years beyond. We look forward to joining efforts with everyone on the call and very much look forward to the partnership. Thank you very much.
Thank you. Thank you very much. Honorable Ministers, distinguished delegates, ladies and gentlemen, we've had a long set of interventions for you now with a number of good ideas from several experts and also global leaders. Let me just give a few, maybe 5-point summary. It's not an attempt to summarize what has been said here, but it's to underscore the purpose for which our Director General in IRENA and also Director General WHO decided to call this group together. The first message in the opening, but also in this panel, is for joined up action, joined up thinking, the nexus approach, that it is not energy by itself, it's this nexus, this connection between access to energy and efficient, effective healthcare delivery, which is very crucial now as we deal with the pandemic. And the fact that they've all gotten together and brought other leaders like Raj Shah and others together to be part of this means that we are also trying to send a message that we need energy ministers and health ministers to work together. To make that happen, the Director General of WHO and the Director General of UNDESA mentioned that in fact we've set up a mechanism called the Health Energy Platform for Action. We've worked on that for over 2 years. There's several UN agencies, the World Bank and NGOs involved to see how we bring health ministers and energy ministers together globally to advocate for more action and more resources, but also nationally to ensure that they work together. And we've seen very good examples from countries on this panel that in fact it can be done. From all the presentations we've seen, Ghana, Burkina Faso, India, and so on, they are doing this already and they're almost there. Ghana is almost there with universal access. They want to finish it before a decade. Can we take them to that end so that we have a showcase for some of us in sub-Saharan Africa that it has been done? It took them time, but they stayed the course, and here are the results. The rest of you can do it. Burkina Faso, also good examples. The same with our State Minister, Sri Sindao from India, also showed that it can be done. We also heard from Gavi that in fact it can be done faster. They've given examples how they've done immunization, and they are not energy experts, but they've helped to improve energy technologies and solutions for their freezers, removing batteries to introduce other systems of direct cooling. So we've seen that it can be done, but the challenge still exists, the scale. We need to move faster, we need to move at scale. And so I'll end with what Dr. Niera said. We don't want to leave anyone behind. Unfortunately, we are not on course to achieve SDG 7. The numbers are still there, almost 1 billion still without affordable, reliable access to electricity. We have almost 3 billion still using firewood and charcoal. And the Director General of UNDESA talked about household air pollution, the silent killer of women and children, over 4 million premature deaths every year because women have to cook, because children have to be with mother when they're cooking. That is not acceptable. We've talked about electrification of healthcare facilities, but our HEPA platform is also about ensuring that we bring clean cooking solutions to a household, because in fact, there is evidence now that the inhalation of that smoke by women is creating pre-existing conditions that will make corona, in fact, spread even more. So this is a clear and present danger as well we have to address. It has been a pleasure for me to facilitate these discussions. It is the beginning of a major partnership between energy ministers and health ministers. We will try to convene more of these over the next several years, but resources are needed. Ideas are good, experiments are good, but it's about speed and scale now. We have a decade to go before 2030. Can we build a more inclusive, just world that also where nobody is left behind? And yes, we've electrified all these health facilities And yes, women do not have to die because they cook or because they deliver babies. With that said, over to you, Excellency Vice President, to invite member states who would want to reflect on this as well. Thank you very much. It's been an honor for me to facilitate the discussions. Over to you.
Thank you, Dr. Jumelka, for your words, and thank you to the panel for these important and inspiring discussions. I would now like to open the floor for interventions. We have a full list of requests. Kindly be reminded that interventions are limited to 3 minutes. With this having said, I will give the floor to the distinguished representative of Fiji. Fiji, you have the floor.
The opportunity to participate in this discussion on a topic that's very important, providing energy for the healthcare facilities, especially in our rural care health facilities. Small island nations like Fiji, where we have a lot of our health facilities out on the islands, they are not hooked up to our main electricity grid, and we need to be able to provide power for them. The challenges that they face in these facilities, that they are remote, that they are small, they have often don't have any technical assistance. So if anything goes wrong, the whole system falls down. It does not work. What the government of Fiji has done in the past is that we've established rural government stations that provide power for villages and all the government facilities in a particular area. Over time, and we're very thankful to the government of the United Arab Emirates that has helped us to fund 3 such rural government stations in terms of the provision of power, and they've added a solar facility to this, so that these are hybrid solutions. And this is sort of like a transitioning away from diesel power to renewable energy with a hybrid solution in the middle. So we're very thankful to the government of the United Arab Emirates for doing that. And that is a kind of a system that we hope to be able to replicate in other parts of the country. We also have other health facilities that are away from larger communities. And in these cases, we need to build standalone solar systems that and the systems must be such that they can provide all the power that is required for the kind of equipment that they have in the health facilities. And also to be able to store vaccines, especially very important in the time that we have now, so in this challenge of COVID-19. So these are some of the challenges that we have in our healthcare facilities. In Fiji, we have prioritized two particular sectors, education and health. Significant part of our budget goes to it. And there's also a focus on making sure that we provide electricity and power to these particular sectors. So the prioritization of the sector, of the health sector in particular, and the provision of power is something that is already in place at the moment. The challenge that we have is always in getting the funding or funding solutions to allow us to implement what we have set out to do. And I think the role of IRENA, what it's been doing so far, has been excellent. We congratulate IRENA for the events that it has had, the International Off-Grid Renewable Energy Conference and Exhibitions, and also the International Conference on Renewable Energy Solutions for Healthcare. It's giving ideas, giving us an idea of what can be done. But we look forward to the blueprint that is being developed by IRENA on the design for healthcare clinics. I think that's a result of the program that is being tested in Burkina Faso. One of the things that we found in Fiji that working together with IRENA has put us also in contact with other organizations, such as the International Solar Alliance. And that is one organization that is also going to be assisting Fiji to be able to put renewable energy solutions in 2 of our healthcare facilities. That sort of work, hooking us up, is something that will be useful for us in the future. So thank you for this opportunity.
Thank you, distinguished ministers, for your remarks. I would now give the floor to the distinguished Minister of Zimbabwe. Zimbabwe, you have the floor.
Thank you very much. Hello, Can you hear me?
Yes, yes, Excellency, please go ahead.
Okay, thank you very much. Access to uninterrupted, clean and modern energy remains key to accelerated development in our country. Zimbabwe has a goal to achieve universal access to clean and modern energy by 2030, in line with the Global Agenda 2030. Among her strategies to achieve this, Zimbabwe is extending the national electricity grid to the remote areas, prioritizing health centers and other public institutions at 100% subsidy. This has seen the Rural Electrification Fund, a state-owned institution, electrifying 1,176 healthcare centers countrywide during the period between 2002 to date. In addition to the grid extension, approximately 400 health centers have benefited from solar microgrid systems, which were done by the Rural Electrification Fund. And some were electrified by UNICEF, UNDP, and other development partners. Currently, 87% of Zimbabwe's health institutions are electrified using both grid electricity and solar mini grids. Solar and hydropower systems have also been useful for water pumping, providing reliable clean water supply to a number of health centers in the country. Zimbabwe, like other developing countries, is not spared from the ripple effects of limited access to adequate on-time medical attention in remote areas due to unavailability of reliable clean energy for refrigeration, lighting, and powering of other equipment necessary for vaccination and attention of children and pregnant mothers, among others. With the work of the COVID-19 pandemic, more vaccines need to be stored for urgent administration to locals. Thus, more decentralized renewable energy systems are on demand. Zimbabwe has a renewable energy policy launched in 2020 and a draft rural energy master plan. These strategic documents point out that access to energy resources for off-grid areas and rural health centers can be accelerated by rapid deployment of renewable energy technologies. However, the implementation of the policy documents is being curtailed by limited funding. In that regard, Zimbabwe is calling for IRENA to consider in the program at country level to identify renewables-based decentralized solutions to power primary health care facilities in rural areas. This can assist Zimbabwe in accessing funding for the implementation of the Rural Energy Master Plan, which has already mapped energy resources and energy needs in the remote areas. UNDP, as a development partner, is working with the Climate Change Management Department and the Ministry of Energy and Power Development to develop a concept note for the UNDP Green Climate Fund, Solar for Health program, enabling the provision of sustainable low carbon energy services to public health facilities in sub-Saharan Africa. Successful implementation of this program will go a long way in improving access to clean and modern energy in health facilities and will help countries in their fight with the current COVID-19 pandemic in particular. The program is targeting the following sub-Saharan countries like Liberia, Malawi, Namibia, Zambia, and Zimbabwe. IRENA can assist and support these states in this program to ensure they access funding from the Green Climate Fund, GCF. Once again, Zimbabwe welcomes the current partnership with IRENA and wishes this collaborative effort to be further enhanced. I thank you.
Thank you, Your Excellency, for those important and inspiring words. I would give the floor now to His Excellency Stern Rosnes, Ambassador of the Kingdom of Norway to the United Arab Emirates and Permanent Representative to IRENA. Your Excellency, you have the floor.
Thank you, Mr. Vice President, Mr. Director General, distinguished delegates. Universal health coverage cannot be achieved without reliable energy access in all healthcare facilities. Around 1 billion people are still served by health facilities without regular electricity supply. WHO-led reviews have found that 1 in 4 healthcare facilities in sub-Saharan Africa does not have any access to electricity. Lack of access to energy contributes to the current profound healthcare challenge. As a consequence, operation of critical medical devices, including vaccine refrigeration, is made more difficult in many places. Access to affordable and renewable energy is at the heart of combating the COVID-19 pandemic. Experience and data confirm that our response to COVID-19 will, to a large extent, depend also on our ability to provide adequate energy services. Providing more reliable electricity to health facilities will increase dramatically the number of life-saving interventions in primary healthcare facilities. Let me briefly outline a few examples of actions we could take. The mini-grid and off-grid solar industry has been the driving force of electrification over the past decade in low-access countries. Supporting off-grid and mini-grid companies and enabling them to scale up, equipping healthcare facilities with electricity access could create a fresh revenue stream, loosen liquidity constraints, and ensure many firms' long-term operation. We need to increase our investments in cold chains to ensure effective delivery of all types of vaccines. Actions to provide adequate cold chain in our COVID-19 response should be expanded and accelerated. Renewable energy technologies should be used to the extent possible. COVID-19 could also potentially widen gender gaps. In our efforts, we need to consider the specific needs of women and girls, such as ensuring that the installations support the provision of maternity services where feasible. More investment in solar-powered equipment and solar-powered refrigerators should be encouraged. Finally, we need to develop sustainable business models for the long-term electrification of public institutions and using the installed infrastructure as a backbone of a mini-grid to electrify the whole community. Thank you very much for your attention.
Thank you, Excellency, for those important remarks and for the work your country does in this area. Now, I would like to give the floor to the Deputy Director of Public Health of the Ministry of Health of Kenya, Mr. Anthony Wainaina. Mr. Wainaina, you have the floor.
Thank you. In Kenya, the Kenya government is implementing the universal health coverage as one of its priorities in its development agenda. Energy or electricity, because of its crucial role in healthcare delivery, has been identified as one of the key enablers for the provision of UHC. And this provision of energy in Kenya has been written under the Kenya Off-Grid Solar Access Project, whose objective is to increase access to electricity services in underserved 14 counties in Kenya. Some of the services that are offered include mini-grids for health facilities, where electrification of areas where electricity supply in itself represents the least, where electrification supply through mini-grids represents the least cost option from a country perspective. The other service is the standalone solar systems and solar water pumps for community facilities, under which we find the healthcare facilities. The health facilities being considered in this component are either already existing or upcoming, and they are in levels 2 and 3 in very remote areas. The solar water pumps are for community facilities, as we have said earlier, and the support is by financing solar-powered pumping systems to increase sustainable access to water supply by equipping new boreholes and retrofitting existing diesel-powered boreholes. Another service that is offered under the same project is that there's consumer education and citizens engagement activities for the program's key delivery areas. There's also the support, technical support in all studies, implementation support, and capacity building of sector and counties. More specifically, the following are included. The study on uptake of greenhouse clean air cooking, clean cooking technology. And from that, we have actually learned a few lessons, and the lessons learned include the importance of interministerial cooperation and delivery of government projects, information sharing, stakeholder participation, consideration of future needs in changing technology and applications in system scaling. We have found that the use of this solar project they're easy to roll out, and there's need for reliable and qualitative data. Our call to the team in matters of technical assistance include continued partnership with the ministries of energy and health towards clean and sustainable energy agenda, call to IRENA and partners to support MOH and partners in the rollout of training and capacity building of healthcare workers with particular attention to level 1 healthcare workers. These are the community health workers, public health and nutrition assistants. There is also need for financial assistance, increasing health sector access to financial resources towards scaling its efforts towards 100% powering of healthcare as an important priority. There's also need to have continued strengthening of existing mechanisms for governance, political and social aspects to help scale up the health and energy nexus to become stronger. Strengthening advocacy towards a more aware and energized players in health and energy will take concerted efforts. We need to continue working together as we endeavor to reach the energy target for all, and so in the long run deliver quality healthcare for all among other agenda. Thank you very much. Thank you.
Thank you very much, dear Deputy Director, for your important remarks. I will now give the floor to Mrs. Sofía Martínez, Policy Officer of the European Commission. Señora Martínez, tiene la palabra.
Muchas gracias. Thanks to the distinguished panelists and especially to Mr. Lacamara and its team. As you know, in the EU, we are global leaders on climate action, circular economy, or renewables, but also on solidarity. We quickly put in place a strong COVID-19 response through a Team Europe approach to support our partner countries. The European Union, its member states, and European financial institutions mobilized more than 38 billion euros. One concrete example is our contribution of 500 million euros to the COVAX initiative. We have understood that the need of increased effectiveness and maximizing co-benefits is particularly important for health and human development through climate action and the deployment of renewable energy, while leaving no one behind, as stressed by Dr. Maria Neira. But also the importance of leverage and shifting additional funding. We need to better coordinate our efforts among stakeholders and international donors. This is one of the key messages I'm also taking from the distinguished panelists from Ghana or Burkina Faso. We have already successful examples in the Gambia, Sierra Leone, or Nigeria, and existing EU financial instruments such as the Electrification Financing Initiative, Electrify, are already working on the electrification of healthcare facilities. But we need to do more and better. Our new multi-annual financial framework for 2021 and 2027 is adopted, including a simplification of the EU external financing architecture to allow for a more consistent and flexible approach, as well as to catalyze private investments via the European Fund for Sustainable Development Plus. Already this year, we are launching, together with the European Investment Bank, the DESIRE program, which will support investments in energy efficiency and the powering of social infrastructures. Of course, Africa will continue to be our priority. We aim at launching an Africa-Europe Green Energy Initiative, a comprehensive plan with two overarching priorities: wider deployment of renewables and increase the number of African people getting access to affordable, reliable, and sustainable energy services for households and for industry, but of course, also for health systems. The Africa-Europe Days last December representing an innovative platform to move debate into action and speed up the impact of the Africa-Europe partnership, including the launch of the Africa-Europe Foundation strategy groups on digital, agriculture, energy, transport, and connectivity, plus one cross-cutting on health. Please let me personally thank our distinguished moderator, Mr. Kande Jumkela, for his engagement as co-chair of the strategy group on energy, where the linkages between energy and health, including clean cooking, will be discussed. Let me finalize by signaling two key events: the UN High-Level Dialogue on Energy and the COP26. We do hope that IRENA leadership will support efforts so health and electrification with renewables are prominently featured. And we look forward to working with you to deliver and drive the agenda forward. Thank you very much.
Gracias, señora Martinez. Thank you for your words and for the important work that the European Commission and the European Union overall do in this important topic. Now, I would like to give the floor to Mr. Konstantin Gura, Acting Head of the State Agency on Energy Efficiency and Energy Saving of Ukraine. Mr. Gura, you have the floor. Thank you.
Dear participants, dear distinguished guests, dear Director General, Mr. Lacamera, on behalf of Ukraine, I would like to welcome you today. And first of all, I would like to say that Ukraine appreciates the opportunity to be an official member of ARENA and to participate in events of the 11th ARENA Assembly. We chosen and keeps the course to clean, energy efficient and competitive economy. We have enormous potential for decarbonization in Ukraine. And this is a chance for us to increase the competitiveness of our economy, as well attract innovations and investments in our country. Ukraine has already opened a huge market for green projects. There are 7 billion euros attracted in the energy efficiency sector and clean energy within last years. About 6.7 billion euros are attracted to renewable energy only. In particular, Ukraine has made a breakthrough in increasing the renewable electricity capacity by 8.5 times, from 1,000 megawatt at the end of 2015 to 8.5 gigawatts at the end of 2020. Last year, the world faced the COVID pandemic, and despite this fact, the green energy continued its rapid development in our country. During the last year, 1.6 gigawatt of new renewable energy capacities was introduced and attracted in this sector more than 1 billion euros of investments. During 2014-2019, the total share of energy from renewable energy sources has doubled in Ukraine, from 4% in 2014 to 8.5% in 2019. And Ukraine has set new goals for the renewable energy and energy efficiency development. 25% of green energy in the primary energy supply until 2035, according to our energy strategy, and 17% minus in final energy consumption by 2030, which set up in draft National Energy Efficiency Action Plan till 2030. Today, I want to pay special attention to the support of healthcare system. During the global pandemic, in particular in Ukraine, there is a need for smooth functioning of critical infrastructure of the healthcare. Such facilities require investments for comprehensive thermal modernization and installation of modern energy efficient equipment. As a result of the negotiations of the Ministry of Energy and Ministry of Health of Ukraine, the list of energy efficiency projects of healthcare facilities in Ukraine was developed, and the total investments in the sector, only these 30 particular projects require up to 10 million euros. We have a lot of tasks and a lot of things to do. But to finalize my speech, I would like to say that Ukraine has a great potential for energy efficiency and renewable energy development, and energy efficiency should come in all sectors of our economy. The introduction of renewable energy sources technologies in healthcare facilities will provide uninterrupted power supply, substitute energy resources, fossil fuels, and increased level of reliability and energy efficiency of power supply. We are open to intensifying our cooperation with all over the world. We are here in Ukraine working on decarbonization. So thank you to IRENA for having us and having this event. Thank you.
Thank you, Mr. Gura, for your words and for the important initiatives that your government is taking in this topic. Now I would give the floor to Mr. Harish Hande, co-founder, Selco Foundation. Mr. Hande, you have the floor.
Thank you, sir. First, let me congratulate and thanks IRENA for giving this opportunity, and especially the Director General. Unfortunately, we are not able to meet this time, and we have to meet via this. I'm not going to repeat a lot of these points that people have raised. So let me go. I think there are two things. One is the combination of sustainable energy and health is a very powerful nexus because it pushes innovations. It's not just about electrification. It's also innovation and democratization of health services. The beauty of bringing sustainable energies and health is we need to innovate on baby warmers, innovate on autoclaves, innovate on shadow lights for operation theaters. That's the excitement, that how do we democratize the delivery of health to the remotest part, where many of the innovations that can then be actually implemented in the other parts where electricity is already reliable. The beauty of solar is three things. It makes sense where there's no electricity. It makes sense where electricity is unreliable. It makes very much sense when electricity is reliable, because wherever electricity is reliable, it is very expensive. So solar makes sense in all three places. The combination, the marriage between the two entities needs to happen, where innovations need to happen on all the medical devices. Because today when people say solar is expensive, because the medical devices are inefficient, they actually consume more than what they should do. So the private sector needs to focus on making appliances more efficient that will lead to more number of health centers. And when people talk of private capital, I have not got a single example of a developed country that is actually providing health services purely on the basis of private capital. But when it comes to Africa, when it comes to poorer countries, where does we always talk about private capital? We need to rethink education on health, are public services, innovations. No airports in the world are financially viable. Let's be very clear, no airports. The health needs to happen. And when we could do in 9 months a vaccine, I think let's create appropriate money channels for Latin America, Africa, and Asia. To give a small example, along with IKEA and Foundation, Good Energies Foundation, and Selco and Duan, in the state of Meghalaya, which has a population approximately 3.3 million people, 200 health centers completely powered by solar using $1.5 million. It's the issue of building design. It's the issue of appropriate medical devices. It is a combination of human resources, health audit, and energy audit that actually makes it viable. So I think we need to get together to look at how do we democratize and the beauty of SDGC is also going to challenge the way health is today delivered, that we can actually deliver a baby right to the remote corner. And thanks, I have friends like Bashir Kande here who've been looking at Burkina Faso and Sierra Leone. Sierra Leone has 6 million population. within a budget of $5 to $8 million, we should be able to provide health services to all, provided we are able to create an ecosystem and the will to actually create action. And today I would say is that the innovations that we can do between sustainable energy and health can actually be translated to education and livelihoods. Let us not miss this opportunity where COVID-19 was a trailer to a crisis, which is a larger crisis like climate change, to actually lose the opportunity for this wonderful nexus. I am so glad that IRENA has taken this mantle of energy and health. It's not about energy and it's not about health. It's together are we actually creating a sustainable society, provided we are serious about actually doing it. So when we have the next IRENA conference next year, we say we have done X number today, that is 21. Next year in 22, are we doing those X number multiplied by 10? If all the people on this panel are actually look at it, it's a simple number game, and we have the money to do that. But let's start doing it by creating those opportunities in rural India, rural Africa, and Asia. Thank you so much.
Thank you, sir, for your comments. I will give the floor to Mr. Gautam Narasimhan, Senior Advisor, Energy and Climate, UNICEF. You have the floor, please. Thank you.
Thank you. Thank you, Dear Excellency, Director General, distinguished panel, and honored guests. Sustainable energy in health facilities is a critical enabler for well-being for children. This is not only due to the climate impacts, because reducing emissions and pollution is the only long-term solution to ensure that the children of today and tomorrow can live in a sustainable world. It is also around the environmental impacts. As mentioned by some of the distinguished colleagues, air pollution kills more people than HIV and malaria combined, and children are particularly susceptible. Sustainable energy importantly helps with developmental impacts. It's a critical enabler for many of the services that children depend upon most, such as health and education, for health equipment, but also for water and sanitation, for example. Given the technological, policy, and business model improvements that have been the topic of this discussion, sustainable energy is increasingly the best way to ensure that this energy demand is met, especially in areas where the majority of health centers do not have access to reliable energy. Also, as discussed, this need is becoming all the more critical given the global pandemic we're facing. UNICEF, along with its partners, is at the forefront of the COVID vaccine procurement and distribution on behalf of the COVAX facility. And together with partners, we're ensuring that countries have equitable access to vaccines while also addressing the energy and environmental sustainability of the vaccine cold chain. And this can contribute to a virtuous circle for climate action. Children who grow up seeing sustainable energy as the new normal and who are healthy as a result are our best hope to make sustainable energy the new business as usual. Now, many of this has already been covered. How can UNICEF continue to engage with the excellent efforts of IRENA and the partners already here convened? One is properly valuing the benefits of sustainable energy in health centers for children as a way of influencing policy and investments. This assessment of benefits should not only be the financial benefits of renewables versus alternate sources, which themselves can be significant, but also take into account the environmental, health, including the public health, and economic benefits for future generations as a way of properly valuing these investments and prioritizing them in policy. The second, helping define the market for sustainable energy services at a granular, decentralized level. Many partners here, both public and private, are deeply interested in financing renewable energy for health, but are constrained by a true disaggregated picture of what the market for energy and related services, including innovative equipment and building design, are, especially in areas that are hard to reach. Private sector players may wish to engage, but don't have enough information on the market, while public agencies need this information to right-size their support to the private sector. Now, UNICEF has spent the last 50 years trying to ensure that health services reach every child, and we're increasingly increased in this activity. Third, engaging young people in sustainable energy activities. Engaging young people in sustainable energy activities and skills building is critical if this is to become the new normal, as mentioned. And fourth, communications and mass advocacy. UNICEF would be privileged to add its voice to the initiatives that IRENA is championing around sustainable energy and health, as they lead directly to improved outcomes for children, particularly the most disadvantaged. Dear Excellencies, on behalf of UNICEF, sincere appreciation for the invitation to speak, sincere congratulations on an excellent event, and very much looking forward to our joint actions for the benefit of children. Thank you again.
Thank you. Very, very interesting words you have just expressed. I would pass the floor to Ms. Zaida Saidi, Clinton Health Access Initiative. Ms. Saidi, you have the floor.
Thank you.
It is an honor to be a part of this assembly. As many speakers have mentioned, solar electrification is key to improving health outcomes. As a health organization, the Clinton Health Access Initiative has worked to address 6 of these key issues that we have seen in the solar health space, many of which have been mentioned today. One is this poor health facility data. With key energy players in this space working with health players now, how can we bring this data to the forefront to ensure that the right health facilities are being addressed, those that require energy the most to be able to make progress? 2 is to ensure that these health facilities are sized correctly. They have the right amount of power that in order to grow the types of medical equipment that will soon be there. 3, as the Honorable Minister from Burkina Faso shared, the cost of solar panels and batteries are fast decreasing, but there is still room to potentially reach these economies of scale and decrease these costs by working with multiple suppliers, by working with service providers in country. 3 of the most challenging areas in this space that we've seen include maintaining and developing the systems for repair and maintenance, sustainable financing, and coordination between key partners and governments. From our experience in the vaccine cold chain space, we're looking to set up leasing structures with the private sector to set up and operate the health facility solar systems. We are working to bring this evidence to partners and governments on the improved health outcomes to help scale such projects. Overall, we look forward to partnering with organizations like IRENA and the likes of many organizations that are represented here to take this forward. Thank you.
Thank you very much. I would give the floor now to Mr. Mohammed Al Sayed, Islamic Development Bank. Mr. Al Sayed, you have the floor.
Thank you very much, and thanks for this wonderful event today. I really would like to congratulate IRENA for not only promoting renewable energy, but also promoting it for the well-being of the humans. So really congratulations for all the success that they had so far, and ISDB is so proud to be a partner. The Islamic Development Bank, as a multilateral development bank and as a development institution, we always focus on financing with an eye on sustainability. And sustainability is very key over here because we have evidence that we have done many off-grid solutions, which unfortunately, within 3 to 5 years, we found them going offline. And in some incidents, we have them within 6 months. That's because the measures of O&M that we have put in place when we finance these solutions were not followed through, either sometimes by the government financing or sometimes by the trained staff that we have left in place that they leave the place. So really would like to highlight the importance of sustainability and how this is a very key important element in maintaining these health facilities or any off-grid solutions or rural solutions. In that sense, we would like to share also a couple of the 2 pilot experience that we're doing at ISDB of using crowdfunding, individual crowdfunding, to finance off-grid solutions by doing campaign and by utilizing existing platforms in the market. So far, we're having success in that, even though the scale is small, but we try to scale up this model, and we encourage all our colleagues to explore this model because it's really, the need is so huge that not enough agencies are able to fulfill all of that. We're also looking into models of using endowment, which is an Islamic term, awqaf used, which is using long-term endowing assets to regenerate resources that help to self-sustain these facilities. With that, I would like to conclude by again thanking IRENA for this wonderful opportunity of bringing all these wonderful, experienced people. And we look forward to work with all of you and continue working with IRENA. Thank you very much.
Thank you, sir. Definitely, IRENA has done a tremendous job in gathering this General Assembly, and of course, the work of our Director General is well seen in this process. I would give the floor now to Mr. Daniel Schroth, Acting Director of Renewable Energy and Energy Efficiency, African Development Bank. Sir, you have the floor.
Thank you very much, Vice President, and let me also echo the comments of various colleagues to thank IRENA for the organization of this very pertinent discussion, and also, of course, to thank Kande, good old friend, for the excellent moderation of the discussion early on. The topic is of particular importance, as was highlighted from various speakers, for Africa. And some of the historical challenges that we've seen with health electrification in the past, and several have alluded to them, there's now an opportunity to address them more sustainably. Some of those challenges are, of course, the lack of information and data in terms of health facilities, their electrification needs. So I think efforts that are underway by various partners, such as Power Africa, in terms of assessing the loads, getting a clearer picture of what the real needs are critical in that regard. There still has been always a challenge around the financial institutional barriers that precluded in many cases upfront capital investment. And there's also been in the past a lack of business models that really took that sustainability aspect properly into account to ensure long-term service provision, quality of service, technical and operational maintenance into account. And finally, there's also been in the past an issue around silo thinking, rather than looking at this in an integrated way, interministerial way, with the ministries of finance, energy and health looking at the matter together. I think now the situation is different. I think we have the business models, we have the technologies, we have that joint understanding to really reach the scale that is required. In the African Development Bank, we're promoting a number of projects and programs that help to address that particular challenge. Let me just highlight very quickly a few of them. We're working on an Energy for Healthcare program, which will design, trial, and evaluate a guarantee product for financing health electrification. And such a product would be structured to guarantee payments from public sector facilities to private sector energy service providers. Secondly, we approved at the end of last year our COVID-19 off-grid recovery platform, CRP, which is a 50 million co-financing platform that supports viable energy access businesses in mitigating the impacts of COVID-19. And the program supports off-grid, mini-grid, and also C&I businesses, including those specifically supporting the healthcare sector as a response to COVID-19. Third, we approved in December last year as well our Africa Mini-Grid Acceleration Program, which is a Pan-African investment preparation program designed really to transform the scale of mini-grid financing in Africa. The program will create country investment programs which will include a focus on electrifying clinics and schools in addition to households and businesses. Finally, let me just highlight that we also approved financing last year for the first commercial clean cooking fund, Spark Plus Clean Cooking Ecosystem Investment Fund, with financing from our Sustainable Energy Fund for Africa, and also financing that we were able to mobilize from the European Commission. And that's really a first of a kind investment fund supporting SMEs in the clean cooking sector. It will not be sufficient to just rely on grant funding if you want to achieve the scale that is required. So we're looking forward to working with IRENA, and the bank signed recently a memorandum of intent for collaboration with IRENA. And I think a good starting point is the work that IRENA is doing in Burkina Faso, which is also one of the focus countries of our Desert to Power initiative. So we're really looking forward to deepening our collaboration with IRENA and all the other partners connected on this call. Thank you very much.
Thank you for your kind words. I would give the floor now to Mr. Luke Severi, Program Manager, Powering Healthcare, C4All. Sir, you have the floor.
Thank you so much, Mr. Vice President and Director General. My name is Luke Severi. I lead our Powering Healthcare work at Sustainable Energy for All. COVID-19 has brought into sharp focus the inequalities and the vulnerabilities of health systems across the world. Long before the pandemic made daily headlines, the lack of reliable power in healthcare facilities was clearly undermining the quality of healthcare for millions of people in sub-Saharan Africa and South Asia. Today, we are again seeing these barriers created by an unreliable or insufficient power infrastructure in the health sector of energy deficit countries as governments plan for the massive increase in energy and cooling needs that come with national COVID-19 vaccine rollout strategies. Sustainable Energy for All is proud to support the energy and healthcare nexus by leveraging our long-standing Powering Healthcare program. This multi-year program focuses on several key pillars, including data, innovative finance, sustainability, advocacy, and increasingly country-level advisory. One area that we see as critical to the success of our program is collaboration. Collaboration between the energy and the health sector, between the public and the private sector, between global actors and national stakeholders, between electricity providers and medical appliance manufacturers. This intersectoral problem requires an intersectoral solution. On the bright side, just in the last year, we have seen a significant increase in the number and types of organizations making health facility electrification a priority. The richness of today's discussion proves that. Our challenge now is to turn this momentum into action. We need to work together to understand the energy needs of the health sector, to analyze the most appropriate solutions, to de-risk the involvement of different actors, and to unlock the right type of funding and financing at the right time. At SC4All, we have already started providing this type of support to the government of Nigeria in direct collaboration with partners such as the World Bank, USAID Power Africa, and the Nigerian Rural Electrification Agency. In the upcoming months and years, we will be replicating this support to other energy deficit countries as well. Together with our partners, with all of you, Sustainable Energy for All will continue to drive the powering healthcare agenda by equipping governments and their development partners with the evidence and solutions to achieve universal electrification of health facilities by 2030. As Kande mentioned in his recap, it can be done, and it can be done faster. You can count on our support. Thank you.
Thank you, sir, for your words. I will give the floor to Dr. Douglas Webb, Manager, Health and Initiative Financing for UNDP. Sir, you have the floor.
Thank you, Mr. Vice President. Thank you, Irina, for this opportunity. UNDP is a co-convener with WHO, DESA, and the World Bank in the Health and Energy Platform of Action, and supports global efforts to advance access to quality, low-emission healthcare in rural areas. Our Solar for Health initiative, launched in 2017 with funding from the Global Fund to Fight AIDS, TB, and Malaria, and the governments of Norway and the Netherlands, supports countries to install solar photovoltaic systems and health centers and storage facilities in rural and hard-to-reach areas. And this initiative has helped to advance universal health coverage while protecting the environment in over 900 health centers and storage facilities in currently 13 countries, including Zimbabwe, as has been mentioned, Sudan, Zambia, Mozambique, Malawi, South Sudan, Namibia, Nepal, Angola, Liberia, Chad, Yemen, and Libya. And the results are encouraging. An additional 34.5 million people benefit from reliable health services, and electricity costs have come down, for instance, by up to 60% in the case of Zimbabwe. And we estimate that the returns on investment in Solar for Health are fully realized within 2 to 5 years when health facilities with unreliable energy sources are installed with solar power. However, despite this huge potential, which we are all in agreement on, many countries are facing significant barriers, and these include the health sector's limited ability to pay for energy services, insufficient financing for energy capital costs, and the slow changes which we often see in energy sector policies. And we need innovative business and financing models and partnership structures, and welcome governments, partner organizations, and the private sector to join us and help partners in this task. We acknowledge that the electrification of the health sector in rural areas is the key component for the successful response to COVID-19, and especially in extending the cold and ultra cold chain facilities. We also help countries to strengthen the vaccine supply management and cold chain systems through digital solutions to ensure the rapid, efficient, equitable, and safe distribution. And these can ensure that vaccines are kept at the right temperature, and stock levels are monitored in real time, which generates cost savings by avoiding wastage through misdistribution and temperature-damaged vaccine loss. This also requires access to uninterrupted energy sources. So UNDP looks forward to working with IRENA, HEPA, and other partners in the sustainable energy transition in the health sector and beyond. Thank you again for this opportunity.
Thank you very much for your words. I would give the floor to His Excellency, the Director General, to address any matters he might consider appropriate from the interventions. Excellency, you have the floor.
Thank you, Ambassador. No, I have to say that it was a very interesting discussion. Kande has already moderated and make a synthesis or summary of the panel discussion, and the following discussion, following intervention came all in the frame that is being set by the panel. What I can say is that I appreciated the call for more collaboration coming from all that has intervened in this discussion, and so let me naturally thank all the panelists, all the participants that has participated to this discussion, and through them, the government and the organization that they represent. I think there is really space for working together. We have to work together. I think that has been good that we put in the attention of the assembly, the link between energy and health. That is naturally an old recognized link, but due to the actual situation, I think it's important that too many have asked to work together, and IRENA in working and leading on the energy transition will be doing what is in its possibility, its capacity to bring all these actors together and getting things done as soon as possible through the alliance that are already, as the one with the World Health Organization, with the World Bank, with the UNDP, and all the other actors. I very much welcome the intervention of the Islamic Development Bank. This is a partner of the Climate Investment Platform, the Clinton Foundation, others, and the European Commission that will be playing an important role in this respect. So I think it's been a very interesting, valuable discussion, Mr. Ambassador, and allow me, because this is the last time that I will intervene today in this discussion, that I may thank the interpreters, that I wish also to thank all of my staff that has been possible, that these meetings went smoothly and very well prepared, as all the technicians that have made possible this virtual event in a very smoothly way. So thank you all, and back to you, Mr. Ambassador. Thank you very much.
Thank you, Mr. Director General. I would want as chair to commend your work and your leadership of the organization. Certainly things happen for many reasons, but one of the most important reasons is that we have a good captain at the helmet, and that is you. And we commend you and your team for the work of this 11th General Assembly and the successful of it. With that being said, I would like to kindly, as a courtesy to the member states that could not have their participation being recorded from the Ministerial Panel on Carbon Neutrality, to show those participations now. and they refer to Fiji, Italy, Japan, Philippines, and Colombia. So I would ask the Secretariat, in due courtesy to the member states, to please pass the videos in sequence and hear their remarks for that ministerial panel. Thank you.
Thank you for the opportunity. It's very heartening for us in the small island development stage to see that after all the discussions at Paris, which did not lead to the 1.5 degrees, that finally the world has come down to the need to get down to 1.5 degrees. This is absolutely critical for small island developing states, and we're glad to see that that change of mind has happened globally. In Fiji, we've had our Fiji's low emissions development strategy, LEDS, for 2018 to 2050, and this serves as a pathway to transition to a low carbon and blue economy. Our LEDS document primarily focuses on mitigation and outlines several scenarios that achieve decarbonization in several sectors, namely electricity, land transport, domestic maritime transport, domestic air transport, and Apollo agriculture, forestry, and other land use, wetlands, waste, and other cross-cutting sectors, such as tourism, commerce, industry, and manufacturing. In the energy sector, government and our utility, Energy Fiji Limited, is working in collaboration to attract more investments and to accelerate the uptake of renewable energy. EFL is diversifying its supply and is currently in the process of installing the first ever Solar Grid Connect project with installed capacity of 5 megawatts. On the demand side, government has enforced and adopted the minimum energy performance standards on the importation of electrical white goods and the implementation of the energy management systems for businesses, industries, and with the hotels and resorts. In addition, government is currently undertaking the review of the National Building Code to address energy efficiency measures and standards and to mitigate the intensity of severe weather events. In terms of our transport sector, one of our main drivers is to reduce fuel imports and diversify into alternative fuels, such as biofuels. Government, through the United Nations Economic and Social Commission for Asia and the Pacific, or UNESCAP, has already carried out a feasibility study on electric vehicles, and this is soon to be taken to our cabinet. Investing in electric vehicles is capital intensive in terms of the facility setup and the enabling infrastructure, such as the charging stations and the proper disposal of batteries and waste, but it will be worth it. Also, in terms of shipping, Fiji is part of the Pacific Blue Shipping Partnership, which aims to reduce greenhouse gas emissions by 40% in Pacific shipping by the year 2030 and to move towards zero carbon by the year 2050. The introduction of new technologies, such as green hydrogen, will support Fiji towards achieving its target. However, since the technology is still in its inception stage and has not been commercially used in most countries, more collaboration and research is required on its demonstration and how applicable it is for small island development states. Moving forward, the initial priority is that the IRENA collaborative framework should be on scalability, reducing the cost of electrolyzers, and the establishment of the international trade of carbon dioxide-free hydrogen that can be certified and verified in its production route. Thank you for this opportunity.
Dear ministers, distinguished colleagues, and panelists, as it is unanimously recognized, a major effort to develop and deploy clean energy technologies is urgently needed to meet international climate goals and to step up global efforts towards climate-neutral economies. Amongst the many technological solutions available, hydrogen from renewable sources, the so-called green hydrogen, has gained an unprecedented momentum. We shall therefore try to make the most of it because we are deciding today how our tomorrow will look like. Seeking to increase the quota of renewables in our energy mix and to improve energy efficiency, especially in the residential, industrial, and transport sectors, Italy is finalizing a national strategy for hydrogen, which will be an additional token of the Integrated National Plan on Energy and Climate for 2030 and of our long-term strategy for climate neutrality by 2050, which we pursue within the wider EU context. by complementing the large role played by electricity from wind, solar, and hydropower. And in addition to sustainable biofuels, we believe that an affordable green hydrogen could be the key to decarbonizing those parts of the economy named hard-to-abate sectors, such as heavy industry, aviation, shipping, long distance, and heavy haul road transport. We aim to reach a 2% penetration of hydrogen in the total gross final consumption by 2030 by investing around 10 billion euros in the next 10 years, which we expect to generate up to 27 billion euros in terms of GDP growth. We are committed to enhance the interaction between our government and the private sector. We aim at creating a market for hydrogen, building coherent policies, regulations, and incentives in order to stimulate its growth. We intend to develop hydrogen valleys through an integrated approach of green hydrogen generation and its consumption for transport and dairy industries. In other words, we are expanding the number of viable projects supported through a blending of private and public sources, leveraging also on EU funds. Moreover, we consider hydrogen as a strategic tool for a new and fruitful cooperation among nations. Looking, for instance, at the Mediterranean, we think that new forms of energy cooperation could emerge given the possibilities to produce hydrogen and exchange it between Europe and Africa through existing pipelines. Italy, due to its privileged geographical position, could be the ideal bridge across the continents. The Italian private energy sector is fully engaged in concrete and viable projects. We are developing pilot projects on green hydrogen through renewable energy powered electrolyzers. The electrolyzer will be located near refineries and steel in the industries, where green hydrogen can represent the best decarbonization option. Also, we successfully tested the introduction of a 10% mix of hydrogen and natural gas into Italian pipelines, strategically taking advantage of the widespread national gas infrastructure. In this respect, Italy fully endorses the pivotal role played by IRENA in bringing together on a common collaborative platform governments, international organizations, and private sector to scale up the cooperation on green hydrogen at regional and global level. Thank you for your attention, and I wish you good work on this key theme for our future.
Ministers, Excellencies, and distinguished participants, my name is Tadashi Mogi, Director General, Energy Efficiency and Renewable Energy, Ministry of Economy, Trade and Industry of Japan. I am grateful for this opportunity to make an intervention at IRENA Assembly with many ministers from around the world in attendance. Last year, Japan declared that we would aim to achieve a carbon neutral by 2050. In order to achieve this, we have formulated action plans toward 2050 for 14 promising industries from the viewpoint of innovation. We will mobilize all policy measures, including 2 trillion yen fund, tax incentives, and deregulation to implement these plans. Regarding the share of renewable energy, it has exceeded 18% of our total power generation. The amount of renewable energy installation has been increasing steadily, and we will further accelerate its introduction in the future. In particular, regarding offshore wind generation, we formulated the new vision for the offshore wind power industry last year. The government of Japan set a target of 10 gigawatts of offshore wind capacity by 2030 and 30 to 45 gigawatts by 2040. We aim to attract investment from both inside and outside of Japan with the development of an attractive domestic market. We are considering development of joint projects through bilateral dialogues with several countries, and we would like to contribute to the discussion on the collaborative framework on ocean energy and offshore renewables launched by IRENA. In order to address the issue of grid constraints, which is a challenge for introducing a large amount of renewable energy, we are promoting the effective use of existing power grids and formulating a master plan to strengthen the power grids in the medium to long term. In addition, in order to integrate renewable energy into the electricity market, we are working on designing the detail of FIP system to be implemented from April 2022, and improving the market environment in order to stimulate the aggregation business. As for hydrogen, the world's largest renewable hydrogen producing plant is now in operation in Fukushima. The hydrogen produced at this plant will be supplied to Tokyo when the Olympic and the Paralympic Games will be held. The government of Japan set a new target of realizing hydrogen demand of up to 3 million tons at the maximum by 2030 and 20 million tons by 2050, and will take a concrete step to achieve these targets in the future. Hydrogen will also be indispensable for the decarbonization of the industrial sector and other non-electric sectors. Japan will continue to take the lead in efforts to realize a hydrogen-based society together with IRENA. Thank you very much.
The continuing change in climate across the world is posing threat to our environment. To prevent cataclysmal change, the world needs to reach its goal to limit global warming and achieve a climate-neutral world by mid-century. Doing so requires a strong mindset. As a country highly vulnerable to climate and disaster risks, with only 0.3% contribution to global greenhouse gas emission, the Philippines recognizes the importance of mitigation measures that promote inclusive growth. Despite this global pandemic and multiple disastrous events like strong typhoons and massive floodings, the Philippines has been recognized for its achievement in the development and utilization of RE. RE accounts for almost a third, or 33% of the Philippines' total primary energy supply, way ahead of the regional target of 23% by the year 2025. In the power sector, the Philippines has a total installed capacity of 25.531 gigawatts, of which 29% are from renewables, while on the generation mix, RE shares about 21% of the total energy generation. Since the enactment of RE law in 2008, the RE sector contributed to the country's economic growth. Investments reaching approximately $4.35 billion, reducing greenhouse gas emission of approximately 17 million tons of CO2 equivalent, and creating 186,418 jobs. The Philippines is blessed with abundant sources of RE resources such as biomass, geothermal, solar, hydro, ocean, and wind. Our RE target capacity is 20 gigawatts by 2040. Indigenous RE resources and private sector investments are central in achieving this vision. We continue to develop and implement market development support mechanisms that will reduce investment risks and empower electricity end users to participate in the national RE development. Among these are the Renewable Portfolio Standards, a mandatory program for sourcing of RE generation. Another is the Green Energy Auction Program, as well as programs to support distributed energy through net metering and the Green Energy Program, where consumers with average of 100 kilowatt per month demand may choose their own RE supply. 100% foreign-owned companies are also now allowed to invest in large-scale geothermal projects to reduce dependence on coal for energy generation. The challenge is to pursue economic development while recognizing and addressing our vulnerability to climate change disasters by mainstreaming climate change adaptation and disaster risk reduction. Through this dialogue, let us continue to work hand in hand towards global energy transition that promotes not only clean and sustainable energy, but also inclusive growth. Thank you.
Honorable IRENA authorities, country's representatives, panelists, and participants, good afternoon. I want to thank IRENA for convening this event and inviting me to share Colombia's perspectives on the key actions that need to be taken to achieve a successful transition to net zero in the energy sector. I want to start by mentioning that Colombia has been implementing a policy of low carbon development and is preparing its long-term strategy under the Paris Agreement to be net zero by 2050, as was announced by President Duque during the 2019 Climate Action Summit. This is aligned with the mitigation goal of Colombia's updated nationally determined contribution communicated last December, in which we commit to reduce greenhouse gas emissions by 51% by 2030, therefore setting off the promise of an accelerated, sustainable, and resilient development, especially through actions that fight deforestation, Colombia's main source of emissions. This announcement defines Colombia's high climate ambition and states its claim on climate leadership in Latin America. Indeed, we're one of the few countries that have honored the pledge of revising and enhancing our NDC. By doing so, we want to raise awareness of the urgency to take forceful actions to prevent further warming and the need to keep temperature increase below 1.5 degrees Celsius. Colombia is highly vulnerable to the effects of climate change, such extreme weather events. Last November, Hurricane Iota had devastating effects in the Colombian Caribbean region. From the mining and energy sector, we are devoted to achieving this challenging goal. We will contribute to the national target by reducing our emissions on 11.2 metric tons of CO2 by 2030, representing a 28% reduction of the sector total emissions. Also, we were the first ministry in Colombia with a comprehensive climate change management plan. And additionally, the ministry is leading a carbon neutral electricity sector alliance, which seeks to articulate private companies to adopt carbon neutrality by 2050 voluntarily. For reaching net zero by 2050, our flagship strategy within the sector is to diversify our energy generation mix and expand the participation of variable renewables and encourage the development of new technologies such as hydrogen, large-scale energy storage, geothermal, carbon capture and use, among others. In 2022, Colombia will have increased its variable renewable capacity by 50 times compared to 2018, which means that at least 12% of our power will come from these renewable sources. Since the beginning of our government, our approach has been to provide enabling conditions to make the energy transition a reality for Colombia. For this, we have established fiscal incentives, a robust regulatory framework, and suitable financing schemes to raise the appetite of investors. We held 2 successful energy auctions in 2019 and will be holding a third in 2021. Furthermore, we are focusing our endeavors in determining the country's potential for the development of green hydrogen, considering the abundance of sun, wind, and water as renewable resources that are key to producing this clean fuel. We partner also with the Inter-American Development Bank to define a 30-year roadmap to establish a national hydrogen market, evaluating possible sources of green and blue hydrogen in the country, market opportunities in different segments, and export possibilities. This roadmap will be ready in the second quarter of 2021. These initiatives have positioned Colombia as an active participant in the Green Hydrogen Working Group at the World Energy Council as well. Finally, I would like to highlight that Colombia is thinking of hydrogen as a regional ambition that would support the RELAC goal, which stands for 70% of renewable energy in Latin America by 2030. We have discussed with the Chilean government about the importance to accelerate the development of hydrogen-based technologies in Latin America, and we also celebrate that countries like Brazil and Argentina are already working in determining their national hydrogen potential. Thank you very much.
Thank you to the participations of the countries in mention and for their remarks. In closing, I would like to inform you that Burkina Faso will report back to plenary on Thursday, 21st of January, on these important discussions that we have had today. I also express my sincere gratitude to all participants, and especially I would like to commend again the remarks of the Secretary General and his work and leadership in the organization which has been very inspiring. This concludes our consideration of the Ministerial Plenary Meeting, driving the agenda for energizing healthcare. I adjourn the meeting in this moment. Distinguished colleagues, we have reached the end of our deliberations for this evening. The Assembly will continue tomorrow at 15 Gold Standard Time. We will open with agenda item 10, reports from ministerial meetings and other events, and take up the rest of the agenda. Before I conclude, I would like to extend our gratitude and appreciation to have served as Vice Chair of this 11th General Assembly. We as Costa Rica are keen on renewable energies and energy matrix transition, and certainly we will support IRENA in its different programs and initiatives. We think that the panel on health and energy has been especially important at this time and facing the challenges on the pandemic, on COVID-19. I think that having made this panel have given an important added value to these already very important topics at the General Assembly. So I would like to commend the General Secretariat and the Director General for having thought so wisely on these important linkages at this precisely time where all of us countries have been suffering in one way or the other the pandemic. And in so I would like to, without other matters in agenda, I would like to adjourn the session of today. I thank you all as Vice Chair of Costa Rica, and we will see you all tomorrow. Allow me finally to express our sincere appreciation to the host country, the United Arab Emirates, for their hospitality and their generosity in hosting IRENA here in Abu Dhabi. Thank you very much, and the meeting is adjourned.